Ladies and gentlemen, please welcome to the stage your host for this session, Indu Subaiya.
Okay, everybody, welcome back from a short but hopefully fun lunch. And my task on this next session is to introduce you to a group of speakers. They're going to come up in rapid one-by-one presentations and some two-by-two. But their goal is to share with you a series of real data sets that are available today and data resources that you can avail yourself of. We're going to be seeing some live demonstrations and hopefully getting useful tips to put into action. So my first presenter today is David Grant. He is the director of the California Health Interview Survey at UCLA. And he will be showing us a series of online tools to access population health in California. And it's part of something called the Ask CHIS system. We're going to see a review of the Ask CHIS system, but he's also going to introduce a new version of this platform called the Neighborhood Edition, where he'll show us how they're adding geographic granularity and flexibility to this data set. So with that, David.
Great. Thank you very much. It's great to be here this afternoon, and I'm usually speaking to people right before lunch. This is much better. I don't think you've had enough to eat to get comatose yet. So if I do poorly, it's all on me. So I want to tell you a little about two different things. One I just got asked about backstage and realized I really need to tell you, and that is that the most recent data from the California Health Interview Survey will be released in June or July. So we're very close. And that's data that will cover both 2011 and 2012. We have a continuous survey, so we've changed that a little bit. And then the second thing is about a new tool that we're calling Ask CHIS Neighborhood Edition. And I want to just kind of go through a little demo of that today to let you know about this new tool that we hope to release in about a year's time from now. So the California Health Interview Survey, some of you may have heard of, it's the largest state health survey in the country. But it's not just a survey. We don't just collect the data. We're committed to disseminating that data as well. And we've really been committed to democratizing access to data and putting data in the hands of those who can use it. So we have a lot of different dissemination tools to do that. And the one that's been most popular and most successful for us is a tool called Ask CHIS. And does anybody out there, can I see a raise of hands, anybody use Ask CHIS before? Wow, that's great, great. And you are one of a large and growing community. Since the site launched about 10 years ago, we have about 38,000 registered users of the system, and they've made nearly 900,000 queries of CHIS data. So we're really excited about that. So I'm just going to show you very quickly Ask CHIS, and this is our website, our homepage at the Center for Health Policy Research. Ask CHIS is prominently displayed. We have you log in. It's free, of course, to use Ask CHIS, and you can use our data 24/7. Ask CHIS has been successful because it's really good data that you can't get anywhere else. But it's also, the system guides you through a simple series of steps to get you to a data. So you define a geographic area, you select a main topic. There's two options. You can compare it to do a cross-tabulation. You can limit your population to a specific gender or ethnic group or poverty level, and then you can get your results. So we're in the Bay Area today. I'm going to select specific counties in California. Hopefully. Try one more time here. Here we go. So I'm going to pick the 7 or 8 or 9 counties that we have here in the greater Bay Area. I'm going to go ahead and select those. And here I can pick a main topic, and we have a whole bunch of things to choose from. You have drop-down menus, or you can search for a topic. I'm going to take health behaviors, look at something we all know is a scourge of modern society, smoking. We'll select smoking. And here's where I could do a compare by to cross-tabulate my data by some other factor. I'm going to skip that. I could limit the population again to some group. I'm going to skip that and just get right to our results so we can see what we get. And this tells me that based on our 2009 California Health Interview Survey, about 12.5% of the Bay Area population smokes. But nobody wants to know really about the Bay Area because nobody is in charge of the Bay Area. So we want to maybe compare counties in the Bay Area, and we can quickly do that through a geographic comparison and say, compare, and here we get results on how the counties differ, the smoking rates in the counties differ, and we can see that San Francisco and Alameda are at the low end at around 11%, and Solano is clearly the highest at 22%. So this is great, very handy, very quick and easy to use. But even from the beginning, when we first launched CHIS and Ask CHIS, people said, well, Alameda is great, but I want to know about Oakland, or I want to know about East Oakland, or I want to know about San Leandro, or I want to know about a certain zip code or group of zip codes. So how might we do that? Well, we can't do it with direct estimates. CHIS samples individuals at the county level, but we can build a model of something like tobacco use at a larger geographic level and then apply it to a smaller area, like a zip code, like a legislative district, like a city. And that's what has pushed us to develop this new tool that we're calling Ask CHIS Neighborhood Edition. And the idea behind Ask CHIS Neighborhood Edition is to answer those questions like, what's the smoking rate in my zip code? What's the obesity rate in my zip code? How about the legislative district I'm in? How about my city? I want to compare that to the county and the state. This tool is designed to do that. So when Ask CHIS Neighborhood Edition, and this is just a simple mock-up of what we have in mind, but it will guide you through a similar set of easy steps. You can pick, for example, zip code, and you'll get drop-downs for your zip code, and I'm going to just take a couple of zip codes in Butte County, select those. Then again, we'll select the main topic. Now, unlike Ask CHIS, we don't have hundreds and hundreds of things to choose from because we're doing models for each of these indicators. We'll start the system with about 15 of the most popular indicators that are currently available on Ask CHIS. And we can take, for example, currently uninsured. I can compare it to another geographic area like the county as a whole. And I can get results. And this would give me my 2 zip codes, currently uninsured rates for each zip code, and then a comparison to the state. Now again, these are modeled estimates. They are not direct estimates based solely on CHIS data. They combine the CHIS data with population data, and we think this is hopefully a very attractive new tool for all of you who are interested in very local level data for community health needs assessments. And we hope this will be a wonderful tool to help build community health in California. Thank you very much.
Thank you, David. I'd now like to introduce JoAnna Caywood, who is the Senior Director of Programs and Partnerships at Lucile Packard Foundation. JoAnna has been with them since 2003, and she just told me that she was responsible for creating kidsdata.org along with Andy Krakow, our very own in the audience. Kidsdata.org is a very amazing platform that aims to make a wide range of data sets, high-quality data sets, both at the local level and at other levels, easily accessible to folks like you, policymakers, advocates, and others that are responsible for influencing children's lives. And today, we're going to find out about some new sort of options and ways in which we can access this amazing platform.
Thank you so much. It's great to be here. So part of our mission at the Lucile Packard Foundation for Children's Health is to elevate the priority of children in California. And so to do this, we engage in a wide range of efforts to help bring attention to the needs facing children and families in the state. And in particular, we have an interest in promoting access to and use of data in decisions that affect children's lives. So that's where kidsdata.org comes in. So the site has about 500 measures of child health and well-being. Most of the data are available at the county level, but depending on the data sources, some data are available for cities, school districts, and legislative districts as well. The data on the site come from a variety of well-established sources, including the California Health Interview Survey, and the American Community Survey, and the State Department of Education, and about 35 others. The data are also in a state of continually being updated, so we're always working around the clock to keep the data as up-to-date as possible. I should mention the site is free, a public service of our foundation. No subscription required or anything like that. So let's jump into a quick demo of the site, and I'll highlight some of the data sets and tools that are available. So there are three main pathways into the data. You can find data by topic, data by demographic group, or data by region. Alternatively, you can search. So let's search as an example for obesity data in Alameda County. Okay. So the first result that comes up says Alameda County, overweight, obese students. Let's click on that. So that brings us to a table showing that about 35% of students in Alameda County are overweight or obese, according to 2010 data, and that compares to California's 38%. So right below every table or graph on the site, we provide the definition of what you're viewing. So in this case, we can see we're looking at public school students in grades 5, 7, and 9 who were overweight or obese according to CDC's growth charts. And the data source is provided right below that. And we always include the links to the original sources because we think it's important if users want to dig deeper in specific data sets that they can easily do so. So it might be interesting to see how this data has changed over time. To do that, just click on the Trend tab right above. And now we can see California in green here has been holding pretty steady at about 38%, and Alameda County in blue has been hovering consistently below the statewide figure at about 35%. So if you wanted to pull in some other counties for comparison, you can just click on Choose Counties right above, and I will grab a couple of counties as an example. Let's get San Francisco and Fresno and hit Submit. And now we can see Fresno in red here at about 43% and San Francisco in orange at about 32%. So let's say you wanted to take this graph and put it straight on your website or blog. The options to export are available at the top right of every page. So there's an embed link right there. So we could click on embed and just copy the code provided there to put this graph on your website or blog. And a couple of things with this, then every time we update the data on kidsdata.org, it'll automatically get updated on the embedded graph on your website. And also the tools to customize the data displays and to select specific counties will come through with the embedded graph as well. Other export options, you can copy this chart straight into Word or PowerPoint, download into spreadsheet format, download a PDF that's formatted as an overview of California on these data, or share through other online features. Okay. So it might be interesting coming back to the data display options to see this one as a map. So I'm going to click on the Map tab. Now we can begin to see the variation among counties in California on this measure, with the counties in red having the highest percentages of overweight or obese students. So I'm going to zoom in to the Bay Area here. And I want to point out the Customize option right above. So if you click on Customize, you can change the year of the data, and the options that will appear here will vary depending on the indicator. So some might be available by age or race ethnicity or other options. One thing that's available for any map you're viewing is this option to show legislative district boundaries over any data you're viewing. So let's take a look at that. So I'm first going to select Assembly District, and then a couple of Bay Area districts, 13, 16, and hit Submit. Okay, now we can see how this measure aligns with selected legislative districts. And if you click on these blue markers, that'll just show the last 5 years of data for the selected county. So let's take a quick look at the bar graph. Okay, so it remembers the 3 counties we previously picked. Maybe you want to see how all counties compare in this format. So I'll click Choose Counties, and there's an Add All Counties link over here, always on the right. And then hit Submit. And now we have another quick visual for how the counties compare. By clicking on the column headers on any table or bar graph, you can sort numerically. So now we can see that at a county level, the figures range from a low in Marin at 25% to a high in Imperial County at 47%. So while we're down here below this graph, I just want to point out some additional information that we make available on the site. It was really important to us in creating kidsdata.org to put the data into context. And so what we tried to do is, alongside the charts and graphs that you can view, we have summaries of what these measures are on kids' data, why this issue is important, policy implications, and a summary of how children are faring, as well as websites and key reports with more information. So far in this demonstration, we've just been looking at one measure related to weight. If you wanted to see what else was available, you could just click on See Related Data here. And you can see that the measure we were just viewing is also available by city. There's also data on students at a healthy weight, which go up to 2012, and offer some additional breakdowns by grade, by gender, by race, ethnicity, and more data down here. So in the last minute, I'll just highlight a couple of other data sets that we offer. If you go to Topics in the yellow navigation bar, that's where you can see the master list of everything that's available, and these are the categories for which we have data. If you click on any one, you can see the full list of indicators that are available. So our foundation has a partnership with the State Department of Education and WestEd to offer more than 150 indicators from the California Healthy Kids Survey. And if you're not familiar with that survey, it's an extremely rich data set that covers issues such as bullying and harassment at school, which is what we're viewing now, as well as data on dating violence, gang involvement, school safety, and emotional and behavioral health issues. There was some discussion earlier about mental health data and community resilience measures, and in this category, under emotional and behavioral health, you'll see some great data sets related to community connectedness and the sense with which students feel connected to their schools and their communities. So I just wanted to point that out. And finally, we have about 80 measures related to children with special needs from the National Survey of Children with Special Health Care Needs. And those data, while mostly just available at the state level, offer some really critical data related to access to care, quality of care for children with chronic healthcare conditions. So I just wanted to point that out too. And in closing, I want to mention that kidsdata.org is in the process of being redesigned, and we're really excited. This fall, we're going to launch a new version of the site that'll have some new powerful data visualizations and some new and enhanced features for customizing the data. So we're thrilled about that, and I'll stop there. Thank you.
Thank you so much, JoAnna. I'd now like to invite Jorge Palacios to the stage. He's a health program specialist with the California Department of Public Health. And there he works at the Center for Healthcare Quality in the Healthcare Associated Infections Program. And today you're going to show us an interactive map that will allow consumers to become very, very familiar with the tools and features of a website that helps you understand healthcare associated infections.
Great, thank you for the introduction. Good afternoon. I'm Jorge Palacios. I've been working in UCSF for quite some time, and it's nice to be back and see so many good friends that are still here. And what I wanted to do is to give you a very quick snapshot of the Healthcare Associated Infections Program. The program is one of 3 programs that is within the Center for Healthcare Quality. It's primarily responsible for the surveillance, prevention, and reporting of infections within general acute care hospitals as mandated by Senate Bill 739, 1058, and 158. The program was initiated in 2009, December 2009. Since the inception of the program has released a series of reports. Oops. In 2011, the program released the first interactive map with 1 infection being tracked and 4 procedures. Subsequently, in August 2012, the program released version 2, tracking 9 procedures. Below the map, right underneath, there's a legend that displays the icons that are currently in the map, in which states if the infection is lower than the state average, the same or higher for MRSA, VRE, and CLABSI. For surgical site infection, the rate of infection is calculated based on the national average. Besides surgical site infections, there's a central line associated bloodstream infections that you can also track on the map. There's also bloodstream infections like MRSA and VRE. There are at least 3 different or 4 different ways that you can actually find your hospital. You can type in your zip code and get to a location. And I guess it doesn't work. There is also another way that you can get into your city. You can find it by your city or your hospital. So let's say we're going to look at surgical site infections, and we're going to look at column. So here it is, San Francisco General Hospital. So we're going to look at San Francisco General Hospital and their surgical site column, and what we see is that the hospital rate of infection is about the same as the national average. But let's say you had an option of choosing a hospital, and as a consumer, you can do one of the following. If you had the option of going to another hospital, let's say like Kaiser, you can see that the rate of infections at Kaiser is a little bit lower, or it's lower than the national infection rate. If you zoom in into the city of San Francisco and wanted to stay local, you can look at UCSF and to see at the rates of infection. When you see these 2 icons display as such, it's because it's a consolidated institution that is reporting, one for Mount Zion and the second one for Parnassus. So they're reporting as a consolidated hospital. Let's say you have another hospital or another city, and this is one of the things that we're finding out right now from a set of focus groups that we have conducted. So there are people that have hospitals like UCSF or Kaiser that they can move to different hospital care settings based on their eligibility. So if you look at surgical site infections column, UC Davis, it's perhaps a hospital that, if you have the option, perhaps you may want to look at San Francisco or UCSF. There are other procedures that are being tracked right now. Let's say for hip replacement, you can do the same thing. So UC Davis has a rate that is lower than, let's say, San Francisco. One of the things that we're finding out is in the process of unlocking the data is that consumers are looking for as much data as they can possibly get their hands on. So in this process of developing a set of focus group in the state of California, we are in the process of contemplating the idea of removing a lot of the content that appears below the map, changing the word and remove the jargon as much as possible, including lay wording. And we all know about the need for including central line associated bloodstream infections and trying to define it accordingly to how it is clinically defined. What we have received is suggestions of adding videos or simple PowerPoint presentations that can allow the user to understand what is a CLABSI and what it means to them. We are also in the process of contemplating the idea of tracking possible trends to see how one hospital does today and how they do tomorrow. This data comes in on a yearly basis, and it takes approximately about 3 to 4 months to do some quality assurance on the data or quality cleaning. There are many ways of getting to the raw data. For example, you can get into central line bloodstream infections by going into these tabs. This is mainly designed for epidemiologists, but also is created with the intent to have consumers have the full data of their hospitals. So you could potentially click on Table 1 and go to, let's say, neonatal care, and you can choose a category based on weight. You can do a control find and find your hospital and to see how your hospital did in comparison to other hospitals, especially here in California. And the question was, and I think I heard earlier on, is like, who's watching this and what are some of the things and how it's impacting people? Prior to releasing version 1 of the map, the state was getting about 26,000 hits. Immediately after we released version 2 of the map, we have about 80,000 hits. The current trend is probably about 75,000 hits per quarter. So this is one way of releasing data in ways that we can track the number of viewers. The goal is to see and identify where these IP addresses come from with the intent to broaden it for the general consumers. Within the next 6 months, the aim is to actually add one more infection into the map. We're looking at adding CDI and moving that map from Flash application to an HTML5 that will allow all smart users to navigate the interactive map. Thank you.
Thank you, Jorge. Okay, I was told we were going to have 2 presenters, one after another, and this is a team. We're going to have presentations from Gayla King, who's the Health Surveillance Director of the California Environmental Health Tracking Program, and Laura August, who's a research scientist at the Office of Environmental Health Hazard Assessment. Gayla is going to be talking to us today about the tracking program from the Department of the California Environmental Health Program. And this is a part of a national initiative to make environmental and health data and information more accessible and understandable. And the program has developed now an online tool and a set of resources to make it more navigable and accessible. And Laura is a research scientist with the Office of Environmental Health Hazard Assessment that is going to be talking to us today about another tool called the Cal Enviro Screen. And this is a tool that monitors pollutants and stressors in the environment, and it draws data from the tracking program. So it's an interesting example of 2 different sort of departments and data sets talking with each other. So with that, I think Gayla is going to go first.
Great, thank you. So we're looking at our webpage. Our website or our portal is one of the ways that we provide environmental and health data to the public, as well as provide opportunities for stakeholders to work directly with us, like Laura, to get data more specific and relevant to them. So I invite you all, I only have 3.5 minutes to kind of show you some highlights, but to take your time. We have a lot of data and information on this website. We include data and information on various hazards and health outcomes and exposures, as well as tools and resources. I'm going to just show you 2 examples of the type of data. So with our tools, we think it's really important to not only get the data, but also enhance the data, visualize the data, make it more useful for public health action. So we have a pesticide mapping tool where you can visualize agricultural pesticide use across the state down to the 1 mile square area. We have a geocoding service that can geocode any address in California. And we have a drinking water system tool where right now thousands of water systems are uploading and digitizing their boundaries, which hasn't existed before we developed this tool. The other tool I wanted to show you are some of the data that came out of our traffic volume linkage tool. Environmental health, we're very concerned about air pollution and traffic exposure being a big contributor to air pollution. So we've developed a tool that will actually calculate traffic metrics or information for any place in California, any location, whether you have an address or a zip code or a census tract. So this is an example of some traffic density data by zip code. This is data that we created and we provided to Laura for the CalEnviro screen tool, just so you can kind of see a zoom in the San Francisco Bay Area. The darker colors have the higher traffic density. And here's what it looks like in Los Angeles. People were chuckling. Is that just sort of what you would imagine for Los Angeles? So this is our traffic data. And the tool itself is available in demonstration mode on our website. Now I'm going to show one of our data query pages. So we've developed data queries for all of those topic areas that you see here. This is our asthma data query. We have hospitalization and emergency department visits for asthma. Right now the data are through 2009. We're going to be updating through 2011, which is the most complete year. That are available. I'm going to show you emergency department visit data for asthma. You can select any demographic group, race, ethnicity, age, or gender. And I'm just going to show you a bit of the county level data and then, again, zip code level. So all of our data are displayed, and the default are on these tables that are totally clickable. You can sort by column. You could also click on a county and view time series data for that particular county. This is looking at asthma emergency department visit rates for Alameda County. You can also look at a chart of the data as well as maps. And again, it's also exportable and printable here. Now I'm going to show you some of our zip code level emergency department data. This we've done in a Google mapping application, so you can pan and zoom around the state, and I'll zoom us into where we are now in San Francisco. And for those familiar with the Bay Area, the darker colors are where the hotspots are, and that are pretty familiar with folks who know Bayview Hunters Point in San Francisco. We have West Oakland near the ports, Richmond near the big Chevron refinery. So this data, definitely seeing it in this way, resonates with our Bay Area stakeholders. So this is another example of some of the data that we've provided to Laura and others that I've actually met here today, which is exciting to see how our data are being used. And I'll now turn it over to Laura to talk about her tool.
Great, thanks, Gayla. Wait for a second to get my things loaded. All right, so I'm Laura August, and I'm a researcher at the California EPA, or the Office of Environmental Health Hazard Assessment. It's a mouthful. And I'm here to talk about, it's not up? Oh, there we go. CalEnviro Screen, which is one of the first comprehensive statewide environmental health tools. And it's a geographically based tool where we've combined information on pollution burdens from all sources, air, water, soil, as well as different health indicators, such as like what Gayla mentioned, things like asthma and low birth weight, as well as socioeconomic status indicators, to understand areas of the state that might be most vulnerable to pollution and have some of the highest burdens of pollution. So us as an agency can prioritize our resources, better enforce these places, and look at it more holistically about what are all the different things going on in communities across the state. So we developed a model, and it's a geographically based model where we're looking at zip codes in California, and there's about 2,000 zip codes. And we've combined information about pollution exposures, as I've mentioned, things like air quality, health outcomes that could make a population more vulnerable to the effects of pollution, asthma and low birth weight, as well as socioeconomic indicators that could also make the population vulnerable. And so we have a series of 18 different indicators that we combine together, and we've gathered data from the census, as well as our boards and departments at the California EPA, to get information on air quality, water quality, as well as the Department of Public Health. So we developed a measure to combine all of these together, and what essentially the tool is looking at is we're looking at where are the places that that have higher burdens than others. So it's a kind of a relative comparison. So when it all gets combined together, we have this online mapping tool that we recently released. And this map here shows the top 10% areas of the state. So it's about 170 zip codes. The orange here represents the 6 to 10%, and the blue are the top 5. So I'm gonna, you can, in this tool, you can type in a zip code, an address, any sort of reference in California. And here I have a place in San Bernardino, and this is a place that we've visited a lot, and there's a lot of environmental justice concerns here. And this zip code in the tool, you can click on any zip code, and we can see that this 92408 in San Bernardino, which is east of Los Angeles, is in the top 5% of scoring zip codes. And this online tool allows you to see all of the different 18 data sets, as I mentioned. So Gayla had mentioned traffic, how all of these are all presented here, the different data sets. It's a percentile based, so the higher the percentile that zip code scores relative to other zip codes. So for ozone, this place in San Bernardino is in the 98th percentile, meaning only less than 2% of the zip codes have a higher asthma concentration, so it's not doing so great. Also, asthma is also pretty elevated here. It's in the 90th percentile. And overall, combined, this puts it in the top 5%. We've also have another mapping option where we can look at all statewide scores, not just where the highest places are. So the lighter colors are the places that are a little better off. So I'll take us to where we are here in San Francisco. And it's kind of a medium blue color. And we can see that this place, it's kind of scores kind of medium, so it's doing okay. And asthma is pretty low, but you can see right below it, there's an area that Bayview Hunters Point that scores in the highest 5 percentile, and you can kind of take a look at that. So all of that, if you click on the details here, you can find out more information. We have a spreadsheet, a Google Earth document. And that's it. So just Google Callan virus screen or go to oehha.ca.gov. Thanks.
Thank you. Terrific. And now for our last dyad of presenters, I'd like to welcome Deryk Van Brunt, who's professor of UC Berkeley School of Public Health and also president of the Healthy Communities Institute, and Abbie Yant, who's vice president of community health at St. Francis Memorial Hospital. The Healthy Communities Institute provides a web-based platform and a dashboard that can be used by state governments to look at data in their communities. And they have a whole series of indicators. They aggregate evidence-based best practices, and they have tools for working groups to improve community health. And they also won the HHS's Best Community Health application award last year. HCI has also recently added GIS mapping to their platform, and this allows you to see clusters of health risks and diseases so that you can target your interventions more specifically. And today we're going to see how the Healthy Communities dashboard integrates within San Francisco to see how it doesn't mash up with locally collected data. So looking forward to that.
Thank you, Indu. Hi, everyone. My colleague and I are really excited to share with you this afternoon how you can take population health data, the kinds of data we've been talking about, and mash that up with locally collected data to help you have even more thoughtful community health improvement on a local level. Well, because this conference is in this beautiful city, we chose San Francisco as the site to demonstrate, because this platform is available anywhere around the country. And just to give you a sense of kind of who's behind a localized platform like this, this is all of the hospitals here in San Francisco, the major hospitals, of which Abbie Yant is with one, United Way, McKesson, and some other local foundations, Anthem, Blue Cross Blue Shield. And so it's really a wide group with literally over 100 community partners that all use this platform to coordinate a lot of their work, data, research, grants, et cetera. So this is a data conference, so I'm going to slide over here to something called Community Data on the left, and there are several dashboards you could look at. The main one is the Community Dashboard, which I'll go to, but there's a Disparities Dashboard. There's a dashboard where you can look at how your community is doing against benchmarks that you've defined or that might be defined nationally, like Healthy People 2020. So this is what a dashboard looks like. This particular dashboard here in San Francisco has about 150 indicators in it. The data comes from dozens of different sources. Again, it's a mashup of locally collected data and traditional population health data. I'm not going to go through all of this, but very briefly, you've got things like access to health services, cancer-related measures, diabetes, disabilities, environmental issues, exercise, nutrition, and weight, heart disease, immunizations, and infectious diseases. And it goes into a lot of other areas, including economic factors, education, housing affordability, poverty, et cetera, et cetera. So, and for all of these indicators, there are these little gauges on the side, because when you get a lot of community partners working together, it's not like people want to go through 150 indicators and see what's going on. So the dashboard kind of does the green, yellow, red. If you're in the green, you're in the better half of the values of your community compared to other communities around your state, typically. Depends on the data source. And if you're in the red, you're in the bottom quartile. So with that said, let's jump into a specific example. I'm going to go into the area of substance abuse. San Francisco, in a much more painstaking way than using this website, because they started this process years ago, they looked at their emergency room rate associated with alcohol abuse. And it's a big problem here in San Francisco. They're at about the 10th percentile here in the state, as you can see from this little gauge. Their actual count, if you will, is 60 ER visits per 10,000 in the population. And if you want to jump to the map, which is sort of the new thing that we've done, here's San Francisco, and you can sort of select neighborhood, and let me just sort of center that a little bit. And then you can zoom right in to see, well, where are all these ER rates? Where are they being driven from? Our conference right now is right about here, so we're almost in the heart of this particular region. So the data, they sort of looked at this. I'll just show you one other thing on the data. They looked at this time series of just increasing ER rates associated with alcohol abuse. These are people going to like games, ballpark games, and a lot of folks, the homeless. And so Abbie Yant with St. Francis Memorial Hospital is going to tell you a little bit about, well, what did San Francisco do faced with this problem?
Thank you, Deryk. Yes, in the late 90s, early 2000s, we were experiencing a tremendous upsurge in the overcrowding issue and the ambulance diversion issue in all of the hospitals in San Francisco. And we put together, at the bequest of one of our supervisors, then Supervisor Gavin Newsom, a committee to take a look at what was driving this overcrowding situation. And we were able to discern that a great deal of this, 20% of the problem or the crowding in the emergency departments was related to persons that were not just acute alcohol, but chronic inebriates, homeless persons that had chronic inebriation problems. And so we took a very close look at the fact that these folks needed services, but not necessarily those that were given in an emergency department. And that created the political will to open what is now known as the San Francisco Sobering Center. And that was a huge public-private partnership that is ongoing and is one of many efforts that are going to reduce the number of patients that are seeking care in emergency departments due to alcoholism. To give this greater context, though, this is one indicator on our current dashboard that is where we've localized the data in a tool called Community Vital Signs. I think most of you are familiar with community health needs assessments that are being done in all communities now across the United States. We've been at work on this for many years in San Francisco, and in 2010, we launched Community Vital Signs, which identified 10 priority goal areas and about 34 indicators within each of those goal areas that we chose to work on as a community at large. We identified individuals as champions for many of those issues, and for instance, with the Sobering Center, the staff that runs the Sobering Center had taken it upon themselves to kind of provide occasional updates on the website as to how we were progressing and what the outcomes were of that particular program that was aimed at reducing emergency department utilization due to alcohol-related conditions. And the dashboard that we have here now is, as you will see, is quite a mixture of both social determinants and very upstream hospital discharge data, specifically around the prevention quality indicators. Do you want to talk about the success of the Sobering Center?
Yeah.
In that now we have, since 2003, I think there's over 29,000 encounters And that translates to quite a bit of a cost avoidance. We kind of stay away from cost savings because it may not be a true measure, but what we do see is a cost avoidance where, you know, your normal emergency department visit can reach upwards of $3,000 to $4,000. The cost of operating the sobering center on a daily basis is $2,700, and they're taking in around 10 patients a day. And the patients sometimes come after they've been to the emergency department, but more often they come directly from the ambulance, from the police, or from the street outreach workers. So in those cases, we may be avoiding ambulance cost as well. So it is a continued success. There are issues that we are addressing through the Sobering Center now that we've had this population for some time.
So this one program has annual savings or cost avoidance of, you know, over $4 million a year. There are programs like this all around the country, Pennsylvania, Sonoma, not just around alcohol abuse, around all kinds of different programs. And the formula that works, the bottom line here, is the following. You basically want the latest data that you can get from population health sources and locally collected data, like some of the emergency room visits that we just talked about and some of the goals that they set. Look at that data, select your priorities, find evidence-based programs and policies that help you plan how you want to spend your efficient dollars, because we don't have any waste left. Build your working groups, set some goals, evaluate over time. And that's working for hospitals doing 990 assessments, local health departments doing public health accreditation board, community health improvement plans, state health improvement plans, collective impact, all of the above. So the idea here is that with tools like this and the kind of data that we've heard about, we really can be more data-driven, more evidence-based to improve community health. Thank you very much.
Thank you to our last two presenters. And this was a wonderful panel, lots of new resources and data sets for all of you to investigate further.